And a new study by the World Health Organization shows that one person dies every 40 seconds from suicide. What must be done to address this? And how should we deal with people with suicidal tendencies? And to tell us more about this, we have in the studio WHO Country Representative to the Philippines, Dr. Rabindra Abeyasinghe. Good morning. Good morning, Dr. Rabi. Welcome to New Day. Now, yesterday was Suicide Prevention Awareness Day, and there was a recent study by the WHO where one person dies every 40 seconds from suicide. Could you tell us the significance of this study?
So that's the data that we have.
Right.
Approximately 800,000 deaths are believed to happen due to suicide, and that translates to about one death every 40 seconds. This is a huge statistic. It has huge implications. Every death is a tragedy for the person, for the family, for the contacts. But it's also a huge economic issue because many of the people in these categories are in the most productive phase of their life. They're young people. So it's not only a personal or family or tragedy of scale, but it's also an economics issue. So WHO recognizes the importance of strengthening our response to this issue through strengthening mental health policies. Clearly, we recognize the need to address the challenge of suicides. If we look at the causes of suicides, it's largely hanging, pesticides, poisoning, or firearm injuries. And one of the clearest things we've seen is that if you can restrict access to these means which people use to commit suicide, you can significantly reduce the burden. So we've seen countries where they've achieved tremendous progress, massive drops in suicide rates by just reducing access to these harmful pesticides, for example. But it's also about building skills because it's about coping mechanisms.
Right. Now, you mentioned coping mechanisms. Is there a way to distinguish being depressed and being lonely?
So sadness or loneliness, as we call it, is the normal human emotion. That's something that probably you and me and all of us have gone through at various phases. That is, we don't call that an illness. That's a normal human emotion. But that could sometimes progress to depression when that sadness actually impacts on people being able to perform their normal tasks. They lose focus, they lose concentration, they can't sleep, or they sleep all the time. And when this kind of situation continues for more than 2 weeks, we call that depression. This is a condition that people need help. And so it's important to be aware of this, to be aware of people exhibiting these signs, because by being there for them, by being supporting of them, by recognizing that, and by providing a listening ear to their issues, you can actually help a lot of people get relief from that situation.
Okay.
Sometimes, of course, depression needs not just a good listening ear, but also some people need some medications.
Right. Now, for here in the Philippines, Dr. Rabi, do you know of the current situation of suicide rates? Or how prevalent is suicide here in the Philippines?
On a global scale, you're doing well. I would say you report about 3.2 suicides per 100,000 population. I'm saying that on a global scale, you're doing good because the global average is up to about 20 per 100,000. So on a global scale, that's pretty good. And that probably relates to your family structures and your community structures. But there's still something that we can do, because if you look at the figures, that translates to about 3 million people in the Philippines who are depressed or anxious, who could be supported, who could be helped to become more productive, to contribute better to the economy.
Okay, very good. Now, Dr. Rabi, you are the brand new WHO representative in the Philippines. So with that, really quick, let's get some current status and some of the current medical situations here. Now, let's go over dengue. How is the dengue situation currently here in the Philippines?
Well,
Is it still on the rise?
it's sort of stabilizing, but it's not yet over. I wouldn't say we're out of the woods yet.
Okay.
The Philippines is not unique in that we are seeing an increase of dengue across many countries of the region. Having said that, the situation in the Philippines has been pretty bad this year in comparison to previous years. I believe we are reporting, well, we have reports of nearly 250,000 cases now to the department. So this is a huge situation. But if you look at it, we're seeing some regions where the reporting rates are declining. So this is good. But unfortunately, as you can see out there today, the rains are continuing. More rain means more mosquito breeding.
Okay. Now, forgive me for putting you on the spot, Dr. Rabi, but what is your opinion on the use of Dengvaxia here in the Philippines?
So WHO has its articulated position on Dengvaxia. Dengvaxia is recommended for use only in people who have confirmed dengue infections. In people who don't have a history of a previous dengue infection, it could cause severe dengue.
Okay.
And we are very clear that Dengvaxia is not a tool to address outbreaks.
Okay. Now, really quick, measles. How is the measles situation currently?
Measles situation is improving from I think we have about 49,000 cases and about 550 deaths reported.
So it has stabilized somewhat?
It's stabilizing.
Okay. Very well, very good.
It's declining.
Now,
it's good.
And lastly, HIV. There was. Do you have an update on the current level of HIV patients right now?
HIV situation continues to be worrisome.
Okay.
We estimate that there are about 90,000 people living with HIV in the Philippines. Of that, about 68,000 are registered. A part of them are on treatment. Unfortunately, all of them are not on regular treatment.
Okay, but the antiretroviral treatment for those with HIV, for the HIV patients, are the stock of medications still okay?
Yes, stocks are there. New stocks have arrived. So I think there were some media reports about stockouts, but I don't think that was true. That may have been in individual health facilities or treatment centers. But new stocks have arrived, and I think there is no stock issues there.
All right. Thank you very much for that update. That was WHO Country Representative to the Philippines, Dr. Rabindra Abeyasinghe.